So I've worked at WDH for 7 years, just over 7 years now, and I joined the service as the Wellbeing team leader. So would directly manage the mental health navigators and other staff within the Wellbeing team. So I spent a number of years in that role, which was really useful because the scheme had only been in place for just over 12 months. So I've got a lot of kind of inside knowledge about how we've kind of got to where we are now within the team. And at the moment, I now manage the adaptations and wellbeing team. So it's the bigger oversight of the wellbeing team. So whereas the wellbeing team leader would manage the navigators on a day-to-day basis, the operational side of things, my role as wellbeing manager, would involve more of the strategic type of work and managing the contract, liaising with colleagues within the trust, seeing how the project's going, what's working well, what we could improve even better if, all those kind of things. So we do have some really good relationships with the trust that we work with on this particular project, and that's been the case since I started here, which is not long after the kind of day one, really. And I think that's been key to the success of the project and the service, and continues to be so, really. It's important for us as non-clinical staff to have that link in to the NHS Trust. But it's also important for the navigators to ensure that they've still got that contact with NHS colleagues, and be assured that the clinical side of their role is still being managed. It's a really key service. Wellbeing and your home, but they go hand in hand, and I think it's a key element that is vital to be able to offer our tenants, to make them feel valued. We're not just a landlord. Our vision is to create confident communities. There are various ways that you achieve that. It's not kind of a one style approach. So yeah, I think it's vital, really, that we have this service available, and it's a free service that's available to our customers. Equally, it allows our customers as well to access NHS services without going to the doctor. They don't have to make that first step alone, really. We can support them and navigate them into the correct service that's suitable for them at that particular time. All the teams within WDH would say that the service is of value to them. It has brought something to their roles. It's extended their knowledge and understanding of the difficulties some people might be experiencing. There's someone to reach out to if you're wanting a little bit of advice, but you might not necessarily want to make a full referral. So in relation to the organisation, it's we have got a lot better understanding of mental health and what might trigger someone's mental health to deteriorate. And that's been linked throughout the organisation. So it's not just within the wellbeing team. Lots of other services that we offer within WDH would confirm that they get a good feedback